Thank you. Thank you very much for those presentations. We heard over the course of this morning a lot both about scrambling to have effective communications in the face of an emergency, but also the importance to build capacity and preparedness when there isn't an emergency. On the later point, what appears to be the case in America is a loss at policy and government level of interest once the emergency is gone. So even as, at least if reports are right from many sources, the need for funding for Zika wound up in part having to be addressed by taking funds from, say, building capacity for Ebola or other potentially emerging disasters. Is that, in fact, a global phenomenon? And how, if so, it would seem like one of the most important aspects of this whole endeavor is communicating to policy makers about how to do that. And I'm wondering what is known about effective approaches in that regard.
The IQ test. I think to answer your question, that's a phenomenon that's across the world in terms of that issue. I think what we've been trying to do is, even in the ongoing programming that a country will be doing in terms of health, is to build in the concept of risk communication as a part of it, as opposed to something extra. That's been the problem. It's seen when there is either an epidemic or outbreak, now we have to do something different. But if you think about it from the point of view of any time you're talking with someone, anytime you're trying to communicate, you need these skills, then people pick those same skill sets up, and it's just a matter of switching it over to whatever the issue is they're trying to do. So not treat it as it's something extra. It's something, a part of what any effective practitioner in communication would need to do, whether it's going this way for an epidemic today or it's just doing the ongoing work. What are those skill sets and making sure that people have it? That seems to have been the one that's been working better.
So maybe just to supplement that, I agree with that. It is very frustrating. There isn't money for this kind of work. We don't, particularly with donors, there's no money for staff. If you have no staff, there's no one to think about it or hold the file or to do a brief. So this is a catch-22. Huh? In countries, in developing countries, policymakers, decision makers will argue that, well, they don't have epidemiologists, they don't have lab workers, they don't have healthcare workers, so why should we invest in risk communication? So it really is a very hard sell. I've seen 4 approaches that work. When there has been an outbreak, like in West Africa now, there is an appetite for this. There is a window, and we need to go in there now and help them build on that momentum. So this is a very, very important issue. The second, I think, is many developing countries and many countries take signals from each other, not from international organizations. So in the bilateral agreements that, say, for example, the US has with many of these countries, if these issues are not raised, then governments will not pay attention. They'll be very polite when you go to the country. You'll have a great workshop. They'll have a dinner. We will buy local clothes, but that's about it. The third thing is, I don't feel this area is sufficiently highlighted in the latest international agenda. In the IHR, International Health Regulations, yes, but, it's not really had that much teeth. In the Global Health Security Agenda, this is not one of the packages. Mm-hmm. It's not one of the packages. So when countries are confronted with that, if it's not a package, then there's no funding. If there's no funding, nobody's motivated to do it. So I think at one stage we need to break this. One of the only successful ways I've seen this shaken, if not broken, is trying to convene decision makers, having some sort of simulation desktop exercise through which they themselves understand the big gaps in this critical pathway for themselves. And doing that, I think, is something that is very cost effective, not full-blown simulation exercises, but desktop exercises, followed by a revision of national strategy, followed by planning. So much development work, emergency work is done based on the priorities of donors. So as, for example, to WHO as the most important donor to WHO, I think your government has a very big role to play in this. But I'm a good Buddhist, so I sit and pray and meditate and hope that we can break through this without having to see another Ebola where 3 countries are completely devastated. That would be my wish.
Thank you both for those presentations. And I'm sorry to hear that your assessment is that the IHR is still very low on the global agenda. And if you have any other suggestions on how to move it up, I'd love to hear them. I wanted to ask you specifically about the core capacity for risk communication, whether in retrospect, having gone through what you both just described, you have any thoughts about whether those capacities are appropriate, adequate, sufficient, could use any, additional tweaking, now we have some experience.
I think it's important to say there are only 2 pieces of international law for health. One is the International Health Regulations, and one is the Framework Convention on Tobacco Control. So it has a great value. I mean, it's not punitive, but it has a great advocacy value. I think after Ebola, people are far more serious about it. I think the global health security agenda is investing resources and focus to do these joint external evaluations, which is, if you like, to reset this mechanism, to say, whatever we've said before, it's okay, we'll ignore that, but let's now objectively look at this in light of 21st century challenges. And then from that report is a process that follows for national action planning. So there is an entry point. So to help this JEE process, we were asked to help on the risk communications capacity review. And in fact, the 5 boxes that I showed is a revised look at what, there were 9 indicators before, but we've actually detailed it just to 5 big things people have to do and then sub-points. So I think using the new assessment tool frames what needs to be done in the future. After we do all these 20 or 40 JEEs, we may have to have another revision, but I think already that process has started. So I think we are making progress. But again, you need experts to go on these missions. You need experts who are not just field practitioners who can go toe-to-toe with ministers and presidents and speak at very high level. I have people I've sent who call me back and say, well, my assessment is a 2, but the government wants a 4. What can I do? So you really have to be there and diplomatically work through that and show the government the benefit of having a lower grading so that it opens up the way for investment. So it's quite a tough one, but I think there has been some progress made.
And I would say the fact that they actually reduced the number is very important, I think, for practitioners trying to implement this. Because when there's a lot of them, people get lost in the numbers and they spend all their time trying to fill out the paper and respond to the what's being asked of them and not do the work. So I think just the idea of bringing that down and focusing it, I think really is helpful.
So maybe just to talk about an experience that might be helpful and get your comment. So on the veterinary side, the OIE for several years now has had a veterinary assessment for capacity in countries. And there's well over 104 countries that have gone through that assessment. And that assessment is a framework put in place to ensure that these countries are prepared for outbreaks like this and have all the different pieces put together, or at least understood where they have limits. And what has happened with that framework is that proactively and ahead of time, countries with external groups coming in have actually done a complete assessment of how well prepared they are, including risk assessment, risk management, risk communications. So what they have the advantage is that they now know where they have a weakness, and rather than to search for resources that you've made the case that we so badly need, which is absolutely true, in communications, they already know that ahead of time. And the good thing about that framework is then it can be used as a leverage for obtaining resources to actually pick up these limitations. And I can tell you these countries are much better prepared than what we've seen before. And they're getting some resources from private sector in addition to their governments that they've not seen before. And we think they're much better prepared. But they haven't done this with, the public health community. It's been kind of a single entity by itself. So it just seems to me like this is a WHO, OIE, FAO kind of a strategy to get better prepared and to make sure that when you need the resources for communications, at least ahead of time, people have understood that and made a decision on it. So I don't have any comments on it.
It's the same experience that we're seeing on the polio side. Is by doing that kind of assessment and getting that external view, people are in a better position to argue their case when it comes to funding. At the same time, because of the people coming in to do the assessment, they bring in another angle, and there's not a comparison, but a comparison among different countries as they see how they relate, because countries talk to each other, they watch each other, they keep track. There is a level of competition sometimes. And you see that at play as well in that kind of situation. So I think polio has taught us what you can do with that as well on the risk communication side.
I mean, I totally agree with you. The PVS, it's what they call it, this assessment, is absolutely essential. And some of the ways we're engaging is we actually have a very good relationship with OIE, but they also lack capacity. They have one person doing communications, corporate communication, risk communication, everything at global level. So we've actually surged our capacity to them. And I have a person working 50%, who's in my team, I've donated 50% to OIE to try and build this relationship. And our team goes to most of their regional seminars where their representatives come. At country level, yes, we're trying to do a lot more together. So that's a positive aspect, and the framework is there. We have a tripartite agreement. What's missing is, as you said, the connection between, sometimes we're connected at global level, but within a country, the Ministry of the animal health people and the human health people are in the same building. I was in Sudan. They're in the same building, and they won't talk to each other, but they have an intricate communication mechanism going up to the national level. And it was only when we were there we actually said, should we all sit together? So I think there are many historical relationships and cultures which we have to break. But we use these opportunities for Rift Valley fever to deal with that, avian influenza in Cameroon recently to deal with this, and MERS-CoV. So I think organizations are they're like oil tankers. They're very difficult to turn around, and you don't even know you're going in another direction. But absolutely, I agree with you. This is something to build on and to help at country level for them to come together and to learn to talk to each other. Thank you for that.
Yeah, thanks, and thanks for great presentations. To build on Lonnie's comments and think about opportunities to build that, two things. One, the JEE, the Joint External Evaluations, and you presented on that. And I think, talking about communication capacity within country is a good start to say, okay, how are they doing and where they are. And then, and then the Global Health Security Agenda action packages, you alluded to them. I'm thinking under building emergency operating centers, and it's not just room, but basically the capacity to respond to day-to-day events, exercise, etc. That's another opportunity to highlight capacity needs in communication and do that. And through that, both at the GHSA and through JEE, that intersectorial connection, animal, human, is I think at the core of what it's trying to do. So I think these are opportunities to build more. But yeah, I don't know what your thoughts are.
One of the things I think is really we haven't talked about much during these 2 days is the actual twinning of the academic institutions, say in the U.S., in Europe, with academic institutions in developing countries. And there was a period of time where you saw a lot of back and flow, a lot of that exchange of expertise exchange of competencies, but I see it less now, and that's unfortunate because I think it was a nice way to fertilize and aid a country developing internally their own capacity, but using the input and the expertise from other places. And it's something I think in terms of risk communication, because oftentimes in these countries, they don't really have communication departments in the same way. So they're getting involved and they're doing things, but they could benefit from that kind of exchange of knowledge, exchange of experience with academic institutions, say here and in other countries.
If I may just add on that, I think when we talked about opportunities, this is exactly one. In order to convince anybody at any level, particularly in these sectors, is evidence. So if we are working with academic agencies, but also people who do operational research, then evidence often presented in the right way to the right people can have a transformative effect. And one of the reasons many decision makers are not investing in this is they feel it's soft, it's arbitrary, it's a thing, particularly in WHO, they will say, oh, this is a communication problem. And what they mean is they don't know what to do with it. So it's a communication problem. So I think it's the more we can professionalize these and formalize these relationships where we continuously get operational research about what works and what doesn't work, not just about what's wrong, I think we can systematically use this to it's a cycle of influencing decision makers. I think this is a very important point.
Anyone, any question? Gary?
Yeah, Guy, I really like your development of the guidelines. I want to find out more about how you hope to use them.
You know, WHO has very few tools. We're very poor. We're in 150 countries. We're responsible for everything. And as a business model, it's very difficult. But one tool that we have that all countries understand is our guidelines. Because we have a very strict process of developing evidence-based ethical guidelines. I'm actually part of WHO's Guideline Review Committee, where there are 20 people across the world who review every guideline. And we thought to professionalize this field, that was a very important thing to do. Rafael is on the internal steering committee, which I chair. This guideline, we've commissioned several systematic reviews, and in fact, a lot of US universities are doing those systematic reviews. I'm doing a last-minute gray literature, unpublished literature review, and if anybody has any evidence, published or otherwise, that you want us to know in the next 2 weeks, now is the time to come forward. We will go through a proper process and see if this evidence is robust enough to make recommendations. And if not, we will identify the research gaps. When that guideline comes out mid-next year, this will be our communication tool, our policy tool with governments to say, here is what the evidence shows works in this area for capacity building and for response. And here are the gaps, and we need to address it together. And then Rafael and I, as two of the major agencies involved in it, we will discuss with many of you, I hope, what are the derivative products that can come out of this. So really, this is what ministries of health and governments understand from WHO. If it's a WHO guideline, seems to have a little bit more respect than WHO operations at the moment. So if I'm very honest. So for us, I went back to what works and why not.
Thank you, Gaia. Just before I go back to Jeff for the closing, just a couple of points that I wanted to also share on this particular issue. Obviously, in my many years working in this field, I believe that this is the only sort of a binding instrument where you can see a specific reference to, in this case, risk communication. And it provides a tremendous entry point to strengthen an area of work that I think we all agree is extremely important to the issues that we are discussing today. So I think we've discussed this quite a bit. You know, how can we leverage it more? How can we make it more, I guess, more stronger or sort of a more sort of visible in the work that governments do. But I think that regardless of the challenges that we have, I think that's a tremendously important entry point for those of us who work in communication. And the second point that I wanted to just also share, because it's been raised a number of times around the issue of coordination. Obviously, UNICEF, working with WHO and other partners, we are looking at also influencing the global humanitarian architecture, drawing on the lessons and experiences from the cluster system, which, again, with many challenges, but they have been able in education, in WASH, in nutrition, in other sectors, to develop a set of operating procedures, of coordination mechanisms, of common standards and tools that improve the predictability and the coordination of any particular sector in an emergency situation, including preparedness issues. So for us, again, as part of our engagement with governments and other partners, it is extremely important to also make sure that in that architecture, the risk communication piece is well outlined in terms of who does what, who is responsible for X activities, how we interface with other pillars, and so on. And that's one important initiative that we are undertaking with, again, WHO, OCHA, IFRC, and other partners. So just to make it also clear that there are ongoing efforts, both to improve the response in public health emergencies, but more broadly in the humanitarian sector. So with that, then I'd like to thank both Gaia and Irma for a very stimulating set of presentations, the panel for the questions, and the participants. And I'll turn it over to Jeff for the concluding remarks.